Coronavirus disease 2019, COVID-19, is a contagious respiratory and vascular disease 9, caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. First identified in Wuhan, China, it has caused an ongoing pandemic. Common symptoms of COVID-19 include fever, cough, fatigue, breathing difficulties, and loss of smell and taste. 6. Symptoms begin 1 to 14 days after exposure to the virus. 10. While most people have mild symptoms, some people develop acute respiratory distress syndrome, ARDS. ARDS can be precipitated by cytokine storms. 11. Multi-organ failure, septic shock, and blood clots. Longer-term damage to organs, in particular, the lungs and heart, has been observed. There is concern about a significant number of patients who have recovered from the acute phase of the disease but continue to experience a range of effects, known as long COVID, for months afterwards. These effects include severe fatigue, memory loss and other cognitive issues, low-grade fever, muscle weakness, and breathlessness. 12, 13, 14, 15. COVID-19 mainly spreads through the air when people are near each other long enough, primarily via small droplets or aerosols, as an infected person breathes, coughs, sneezes, sings, or speaks. Transmission via fomites, contaminated surfaces, has not been conclusively demonstrated. 19. It can spread as early as 2 days before infected persons show symptoms, pre-symptomatic, and from asymptomatic, no symptoms, individuals. People remain infectious for up to 10 days in moderate cases, and 2 weeks in severe cases. The standard diagnosis method is by real-time reverse transcription polymerase chain reaction, RRT-PCR, from a nasopharyngeal swab. Preventive measures include social distancing, quarantining, ventilation of indoor spaces, covering coughs and sneezes, hand washing, and keeping unwashed hands away from the face. The use of face masks or coverings has been recommended in public settings to minimize the risk of transmissions. There are currently no proven vaccines or specific treatments for COVID-19, though several are in development. Management involves the treatment of symptoms, supportive care, isolation, and experimental measures. Some symptoms of COVID-19 can be relatively nonspecific. The two most common symptoms are fever, 88%, and dry cough, 68%. 24-25. Among those who develop symptoms, approximately 1 in 5 may become more seriously ill and have difficulty breathing. Emergency symptoms include difficulty breathing, persistent chest pain or pressure, sudden confusion, difficulty waking, and bluish face or lips. Immediate medical attention is advised if these symptoms are present. 25. Further development of the disease can lead to complications including pneumonia, acute respiratory distress syndrome, sepsis, septic shock, and kidney failure. COVID-19 is caused by infection with the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, virus strain. COVID-19 spreads from person to person mainly through the respiratory route after an infected person coughs, sneezes, sings, talks or breathes. A new infection occurs when virus-containing particles exhaled by an infected person, either respiratory droplets or aerosols, get into the mouth, nose, or eyes of other people who are in close contact with the infected person. 28-29. Respiratory droplets may evaporate into droplet nuclei, which remain suspended in the air for prolonged periods of time. Possibility of short-range airborne transmission has been demonstrated in healthcare settings, with certain aerosol-generating medical procedures performed on COVID-19 patients, 30-31, but is also reported to happen in crowded and inadequately ventilated indoor spaces, such as restaurants, nightclubs or choirs. 29-30. Kissing, physical intimacy, and other forms of direct contact can easily transmit the virus and thus lead to COVID-19 in people exposed to such contact. 30-32. A person can get COVID-19 through indirect contact by touching a contaminated surface or object before touching their own mouth, nose, or eyes. 30. Though this is not thought to be the main way the virus spreads. 29. There is currently no significant evidence of COVID-19 virus transmission through feces, urine, breast milk, food, wastewater, drinking water, animal disease vectors, or from mother to baby during pregnancy, although research is ongoing and caution is advised. 3032. The number of people generally infected by one infected person varies. As of September 2020, it was estimated that one infected person will, on average, infect between 2 and 3 other people. 33. This is more infectious than influenza, but less so than measles. 34. It often spreads in clusters, where infections can be traced back to an index case or geographical location. There is a major role of super-spreading events, where many people are infected by one person. Severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, is a novel severe acute respiratory syndrome coronavirus. It was first isolated from 3 people with pneumonia connected to the cluster of acute respiratory illness cases in Wuhan. 35. All features of the novel SARS-CoV-2 virus occur in related coronaviruses in nature. 36. Outside the human body, the virus is destroyed by household soap, which bursts its protective bubble. 37.